But on the medical side, when you think about what happens, first of all, this medical standardization, the PDR, what they're telling people, and they want to tell all of us, is that we have to accept their version of medical care. Not your version, their version. Whatever they decide is going to happen to your body, your carrier, they're going to decide. Now, there was a U.S. Supreme Court decision years ago called Roe versus Wade, right, on the abortion issue, where a woman's body was hers and hers alone to decide everything about what went in, what went out. How has that changed now with this vaccine or anything else in terms of what's going to happen to my body? This is my body. This is my carrier. This is what I own free from everyone. And no government has the right to penetrate this body, except if I say yes. Period. How we do that, when do we draw the line on this? Are we going to accept a PDR, because that's what we almost had with this national healthcare thing where that's your only choice? What about the alternative cares? Many of those that I've mentioned earlier today. That's a tip of an iceberg, and I'm demonstrating things that are now 15 years old or older. The stuff that's out there now is really phenomenal, and what's coming is even more phenomenal. We're going to be able to grow organs, your own, with your own DNA. Stem cell research will let us extract our own stem cells from this body and create our own organs that are DNA perfect. That's coming. We're going to see that happen in our lifetimes. We may get to the point where you can 3D print that even. That's coming. We have the merger of nanotechnologies, quantum computing, biosciences. All of the sciences are merging at a level that is unprecedented. When quantum computing comes in, huge problems can be resolved and bigger problems created. We'll get more into that. But what the medical system has done at this amount of our economy is essentially stripping out the wealth of the country. It's a huge wealth transfer. Here in Anchorage, we have the Good Sisters of Providence, the Catholic Charities of Providence Hospital, a national chain. I'm picking on them because they are a greedy, selfish organization that I resent on such deep levels for what they've done in my state. At this hospital, tens and tens of millions of dollars, up to $100 million, is made as a profit and sent out of my state. There are people dying all through my state, from alcohol, drug abuse, all kinds of things associated with the medical establishment. And they're taking up to $100 million a year in profits out of Alaska. And in Alaska, we have the highest insurance costs for medical insurance in the world. Not in the United States, in the freaking world. I have a friend my age paying $2,500 a month for his insurance, $30,000 a year to have any kind of coverage that would cover him for anything. That's insane, all right? That's crazy. This hospital, this non-profit hospital and its chain, when COVID began, had over $100 billion in their cash reserves, $12 billion in their, this is national, in their national emergency reserves, and then they took $573 million of yours and my tax money to add to that reserve during COVID, along with whatever else they've been able to bill, and I'm sure their profits are up. Now, is that right? They're a nonprofit 501c3 doing charitable work. But they don't pay a penny in taxes, but they took $573 million nationally, took $100 million out of my community, and I don't know how many tens of millions this year. But every dime they spend, I hope they change the laws about nonprofits. They make the money in your state, they spend the money in your state, especially these hospitals. This is a corrupt operation. You know what the average hospital, what the private ones do? I knew a private CEO of a hospital, he's not working in the industry, he told me 30%. Imagine all that medical care, millions and millions, they gotta make 30% margins. Yeah, a lot of money. For EEG, or excuse me, an EKG in Anchorage, I might spend $400. I can go to the best place in the world in the lower 48, the Mayo Clinic, and pay $40. How do you figure 10 times? How do you figure? This is a corrupt thing. One of the things they have in the medical a profession are called certificates of needs. Most states have them. Medical professions lobby for them. What are those? They say that you can't build a facility in my state over $1 million, a medical facility, without somebody's permission. A little committee that decides how much competition ought to exist. Hey, when you pay as high as we do, it ought to be, the road is cleared, come on in if you can beat these prices. But they don't post their prices. You go to get your car repaired, they give you an estimate, and guess what? If they mess it up, you're not paying more. How come you can't get that on your vehicle, your carrier, right? I mean, want to talk about cost of care? How about fairness in an open capitalist society? How about everybody post their prices so you can see what you're paying for? How about asking a doctor how much the surgery will cost? He can't tell you. Germany, they can. Everywhere else in the world, they can. How come they can't tell you here? That's called consumer fraud, see, in the rest of the world, but we give it other nice names called billing codes. You know, 40,000 billing codes are about to hit the PDR when there ought to be 5 or 6. It ought to be simplified, not made more costly and complicated. We're doing it the opposite way. Here's what also happens at the end of your life. You don't get your Social Security kind of medical benefits unless you've exhausted your resources up to a certain point. So if you get destitute, you know, you first spend everything. You got to give it all away first to the establishment, unless you set up a medical trust 3 years before you're chronically ill. This is a secret. The rich guy knows it. 3 years before, so you set up your trust early, put all your property in your trust, and when you're medically ill, the medical industry doesn't strip out your wealth. That's how wealthy people preserve themselves from the medical industry. But you don't. You just get your wealth stripped out and handed off at the end because you don't do trust. They're not that expensive. The new tax laws will probably change that. They're doing a lot of changes. I don't know whether that's good or bad. It's just another way to pick your pocket. But you look at tort reform as the other part. Okay, now we just heard all about the opiate epidemic from these, and they are assholes too. I got to say it twice. There's a second time. Because they got everyone addicted and told all these MDs that these were not addictive substances. And then when they decided to look at places like a county in West Virginia where they had sold like 8 million doses, which for a county of some small number, and you know, they have ways to track that they used to have. They would be able to, you know, track the volume going in, and then they would be able to catch up with these pharmacologists or doctors that were doing this kind of nonsense, so people were getting these drugs. Well, then they shut off the ability to do that because they lobbied for Congress not to do that anymore because they didn't want to get caught anymore. Come on, ladies and gentlemen. They got caught because they were wrong. And so instead of addressing the fact they're wrong and creating better mechanisms to catch more of these people, they did the opposite. Because it's the industries that run Congress. We're going to get into that later, but the medical industry is one of the biggest lobbyists. They have a fifth of the economy, 1 out of $5. You know, they get to tell people what to do, who will listen, and they do listen. Tort reform was about not being able to sue doctors, right, in hospitals for malpractice. Now let's think about this. I get the idea that the doctor doesn't want to lose the alligator golf bag revenue stream. I get that, okay? I wouldn't either. All right, but when I think about tort reform, the biggest area where there's medical malpractice is drug interactions. That's it. Half of them. Half the deaths, 100,000 die from that every year. That's about 8 times as many as die from gunshots. How many medical malpractice suits do you read about in the newspaper? I'm just talking United States. 100,000, that's according to Harvard, and I believe the number's about double that these days. But that's a good number. Gunshots are about 20,000, maybe. Today, they were about 15 when those stats were out. So, you know, we look at things, we draw our attention to certain things, other things we ignore. Medical malpractice. The drug interactions being most of it, and you know how easy that is? Centralized prescription databases that you get to make sure all of the prescribing physicians about you, so they're there. And then computers can sort that out because doctors can't. It's too complicated. Between the supplements you take and the drugs you may be on, the interactions are impossible for any MD to sort out. It has to be done by computer now. It's too complicated. So it can be done. Should be done. Half of medical malpractice would go away, but insurance companies and others don't want to share the data. That's the truth of the matter. Centralized billing is for the same reason. A centralized, simplified billing with less codes would reduce the cost of administration dramatically, but they don't want to share the data. So you got to force them. You've got to force it. My dad, when he was doing education in Alaska, why did he go to the legislature, the Senate? He tried to do it through the unions, the teachers' unions. They were worthless. Tried to do it through the school districts and administrations. They were worthless as they are today. Nothing's changed. So he went to Juneau, the capital of Alaska, and wrote law and packed it down educators' throats with many of their cooperation. The teachers, the ones who wanted to deliver better education. They were the ones that my dad listened to because they were the ones educating our kids, and they were the ones doing the job. Everybody else was in the way, more or less. And he worked his way through that whole process. You know, when he was a principal, he organized a statewide principals association that exists to this day. When he was a superintendent in his 20s, he organized the State Superintendents Association. It still exists to this day. When he was in the legislature, he created the teachers' retirement system and the public employees' retirement system and the collective bargaining system and special education and the first kindergartens and the first rural health care, and on and on and on and on and on. Because a good leader has the energy and the knowledge to go on and on and on. And what you've been watching here for hours is a leader. I'm not running for anything, but this is what you should demand of leadership, or they're not qualified. If they can't do this, if they can't articulate solutions that are real, then they're just BSers feeding you fertilizer when it's not. It's BS and you're eating it. Quit. Demand performance from these people, and don't let them off the hook with 2-minute debates run by teleprompters. You know, don't look at this president right now. He won't even do a press conference openly and honestly because he can't talk. Now, it's not because he couldn't once upon a time. I'm sure he could, but he can't now. And anyone dumb enough to not see that is dumb. Just plain dumb, or just doesn't want to believe what they see. Why do we have a closed government when we need it open right now? We need a president that stands in front of us that gives us confidence right now. Is this the best? These two guys that just ran this thing? Really? I don't believe it. They're the worst because they're manipulated in some fashion or another, or they have such low character. You know, Trump got in there in error because they didn't have anyone better. And you know who people voted for? The guy that was at least as flawed as he was appeared to be honest about it. Yeah, he was ugly and everybody saw it. I wish we had had somebody that was respectful, that we could respect, that had the character that we'd like reflected, not some bully. But sometimes you need an asshole, is what somebody told me once. Somebody told me this once, a union organizer, and it was a guy and he was really a jerk. And he said, yeah, he's an asshole, but he's our asshole and everybody needs one. Think about that. You know, that's kind of a crazy thing to say, but when you think about it, you wouldn't live very long without one. And you know, as much as we've been kicked around in the world for a lot of different things, sometimes you need somebody who's just a bully. Just one term of a bully might help reset a few things, or at least do it. I wish it was a polite guy, though, and not a bully as such, but somebody who knew their strength and was confident in the nation enough to know who we are and didn't need to be a bully about it. Because who we are when we're who we are is pretty powerful. But we're not that list of felonious things that our government's doing in our name, and that's how we're seen. When people meet Americans, I travel all over the world, they like Americans when they meet us one-on-one. They don't think much of our government. And those are kind of the reasons why. In our name, they've done a lot of damage. We need to take our name back. We need to take back control of who we are again. Medical establishment, a lot of people mean well. They do their best, I'm sure of it. But the systems do not allow them to do their best. Doctors should be free to be medical professionals. They're trained to take care of your health. Give them the latitude to do that. Get them the latitude to bill fairly. Recognize their professionalism. Treat them as the professionals they are. Don't tell them what to think and don't tell them what to write. These guys, the institutions, the pharmaceutical industry, let me tell you how to reform that a little bit. I mentioned earlier what percentage of pharmaceuticals in America are from advertising, 40% of the cost. Now, why do we pay 1 nickel more in America at the wholesale level for a pharmaceutical drug when someone on the other side of the planet pays substantially less? That should not be allowed. A lot of the research comes out of institutions that we pay for, public institutions, public research, that then turns into private patents for private companies, that then allows them to charge whatever they want for healing products. And they do. Whatever the market will bear, wherever it will bear it. Now, you can't stop them from advertising because that's illegal. They have free speech. And like the tobacco industry, people say, well, we stopped them from advertising. Yeah, because they needed to settle a lawsuit because they lied, right, to everybody and said it's all safe and wonderful. So they had to give up the right to their speech. So here's the way you take care of it with the pharmaceutical industry. Think of all those ads you see about things you can't buy because they're all prescription. Simple solution. You can't tell them they can't say it, but you can tell them by regulation they can no longer take it as a tax deduction. And as soon as you tell them that 40% of their expenses are no longer deductible, they have to come out of shareholders' profits, I guarantee you the money will not be spent on advertising, targeting you, a consumer who cannot make the decision to buy that product, and then can no longer put the pressure on your doctor to prescribe something that you may not need. That would be a good move. That would knock 40% of your price of prescriptions out tomorrow. Okay? That's a simple solution within this industry to take it back. The other would be to say to the pharmaceutical industry that A, you can't charge more anywhere else in the world, and then you create a whistleblower mechanism to make it really profitable for the guy that tells on them to get a percentage of that. And then you hold boards, the boards that run these companies and their officers, criminally liable, so they go to jail. See, their corporations get free speech. They can say anything. They can interfere with elections. They can do all kinds of things. They can influence Congress even. And they do. They decide who gets elected and what they come out with in legislation. But none of them can go to jail because we don't let that happen. Their corporations are protected. Pierce the veil. You want free speech? You want to live like a human being? Then you go to jail like one. You want to sit on the boards of these companies? You want to serve as their officers? Your employees better be following the law and respecting civil rights and civil liberties. Because it ought to be criminal, you see, to take our data and kick in our digital doorway. We need to rewrite the rules. Make you liable for when you violate us. Turn those cameras around a little bit. We need to extend the Freedom of Information Act to private companies with a whistleblower mechanism so they can tell on you. Right, you know, as a little kid, I'm telling. Hey, this time we ought to be telling because it's our government that we're telling to listen again to us. So we need whistleblowers mechanisms now. We need ways in. We need ombudsmen. We need ways in. We need people who work in these nonprofits who see this kind of abuse to be able to come forward and say, hey, they shouldn't even have this exemption. It's just a money machine. We need some honesty in some of this. We need to break some of this down a little differently. The Hippocratic Oath is about healing, not stealing. Healing, not stealing. Start with a few different letters at the front of those words, and you get a little different place. That's not the heart of healers. This is the heart of technicians and people who like to make a lot of money, who don't think about health care. They think about what they call systems of health, which are cash registers. Because I've been all through this health thing, and there are very few that operate as a system of anything. Believe me, they don't. They don't even talk to each other. They refer and don't follow up. They're too busy. They get 5 minutes per client. That's not medical care. That's a prescription machine. How many are you on? I'm 62. I'm on 0. Do I look unhealthy? Nope, because I've avoided that system as much as I could. And I'm healthy. Choices are about health. Lifestyles are about health. Thinking about what you're doing is your health. And we're not. We're in too big of a rush. We're in too big of a hurry, and everything is prepackaged, preformed, prepacked, pre-programmed for you. Oh, but you're conveniently served. But I don't think so. Let's talk about medical alternatives. We talked about reducing the number of codes, deductibility, we talked about a little bit, nonprofits and where the money really goes in the medical care, certificate of needs, again, limiting competition. I want to make clear on that one. Again, go back to that just for a second. That means if I wanted to build another hospital to make more beds in Anchorage, I couldn't do it. If I wanted to do it with my own money for cash, they would not let me do it. I'd have to get permission of a committee that says, yes, we have the need. The same for MRI machines, and we pay $4,000 to get one. At one point now, I think it's down to $1,500. And here's the other upside down part. You know, if you pay cash, you pay the highest price for medical care in hospitals. The biggest discount is to the biggest insurance company. And they pay the worst, but they get the biggest discount. But you pay cash, you get screwed. Really, you do. To the nonprofit down the road. Now, what Providence does, I got to say this, if you can't pay and you're poor and you make your case, they'll let you go. I've seen them do that. Yep, they do. But so will everybody, because if you can't collect, you don't. You know, they just are nicer about it. So they give the guy a little bit of kindness on their way through the process. But again, they'll still sell out the collection notices. They'll still turn you over. They're not that charitable. Public funds and patent limits. This is another one. You know, we heard some of these disputes a number of years ago where people bought up companies and then tripled and quadrupled the price of certain medications, inhalers and things that are really critical to people, for people with allergies, lots of different things. You know, that is wrong morally, I'm sure. And you remember this one I heard a lot too. You know, you can't legislate morality. You remember that? We see that associated with the right to life issue. You can't legislate morality. That's another oxymoron, because every law is about legislating morality. A law is exactly that. That's what a law is. It's saying this is a moral principle and perimeter that we're not going against as a community, so this is a law. That's what they are. It's, again, you know, we use words to twist things around in these weird ways. Yes, you do legislate morality. We do it with every law we pass. That's what we do. We decide what our limits are. And we've decided in a number of cases that the body of a human being is your own, but the medical industry thinks it belongs to them, including when you're on your deathbed and they're stripping out the last of your wealth. Certificates of need, all that does is limit competition, wipe them out, forget it, let them live or die by competition, force them to post prices, no more of this nebulous stuff. Post the prices, they ought to be seen, they ought to be known, no more hiding pricing for pharmaceuticals, for medical care of any kind. Absolute transparency and cost will solve a lot of this. It'll allow you to pick who you want, and then their record. You want to know whether you got an A restaurant, a B restaurant, or C restaurant. You can go eat food in a restaurant and find out what it is in California and a lot of other places. Put the label right in the window. I'm not eating in a C restaurant. I don't want that many mice hairs in my food. Okay? How come we don't see that at a doctor's office? How many malpractice cases do you have that you've lost? Might want to know that, you know. Can the guy do the job? Has he failed a few times? How many people have brought him up on ethical complaints that are hidden behind the board of his peers? Because that's how lawyers and doctors do it. Professional boards with one member of the public and a bunch of them. Okay, we got to rethink this. You need to see performance records and costs so you can make the determinations you would make in other consumer decisions. Are you getting your money's worth? And how much is it? You know, that's called capitalism, ladies and gentlemen. A price and competition. Let's put that in the medical field and it ain't going to be 18% of your economy anymore. Just pricing it. Just making pricing fair and getting whistleblower mechanisms in to catch the cheaters. And reward them generously for their information. And guess what? Eventually there won't be very many cheaters because they know they can go to jail and it's less comfortable there. And so let's do that. Make people accountable by just changing simple rules. These are keys, again, these are keys for the medical changes that might be necessary. And let's recognize that our bodies truly are our own, and we should decide our medical care. and that the alternatives ought to be included. That if we're being forced to have medical care, it ought to be the ones we choose, and whatever that insurance is, get your legislators at the state level to change it. In Washington state, you can get acupuncture. I can't get it in Alaska. Other states, you can get rolfing. I can't get it here. This state, you can get massage. I can't get that in other places. Why not? These things work. How about I decide my medical care? Insurers decide, yeah, okay, we'll cover the alternatives, and the government say, you're going to cover it all. You know? And who decides whether the alternatives are good? I think you do. And if they want to figure out some other complexion, great. But quit telling me how to spend my money and what my limits are on what my insurance is and who I can spend it with. These are all questions. And when you're wasting 40% of the medical costs for pharmaceuticals alone on advertising, and you're screwing the cash buyer, and you're not being honest with your pricing, and you're expecting me to buy into this system, I expect to be paying the lowest price. And the law ought to say so, that whatever the lowest price is negotiated by anybody for medical care, it ought to be for everyone. And when you're a nonprofit, you ought to be profiting at zero. In this community, the money profit should be zero. When you leave at the end of the year, it ought to go, okay, whatever's left, we're throwing back into health care, not someone else's pocket. And I definitely feel strongly about that headed for the Pope through the Catholic Church, because the same time they're exporting that money, my city is giving Catholic charities money for the homeless in grants. Wait a minute. What is going on here? We're playing musical shuffleboard, and the only winners are out of town. And that's happening everywhere. Our wealth is being stripped out by the medical profession in a number of ways. And your future wealth, the one that could sustain your next generation, because you don't know what the big families know and you don't have a trust. Talk to an attorney, find out what a trust is. There's cheap. Don't go to any attorney. Find the one that only does trusts, because he's the one that is the cheapest, because he knows what he's doing. And they even do seminars. Learn about this stuff. Take the time. Otherwise, your wealth is gone.